I didn't actually choose nursing. It kind of chose me. When I was applying for university in grade 12, I actually only applied to one nursing school. It was the first acceptance I got, literally in like October, plus they offered me a scholarship. None of the other offers to university I got after that made me feel even remotely as excited. So next thing you know, I'm driving over 1,000 kilometers to start my new life alone in a new city. The work was hard but manageable, but what I really loved was working with patients. And psych was never my plan. All of my work experience had been with kids: lifeguard, swim instructor, bike instructor, volunteering, reading with kids. So when my psych rotation came around, and mind you, I was not thrilled about having to do a psych rotation. I'd heard nothing but horror stories. The idea of getting inside someone's head, getting them comfortable enough to tell me their darkest thoughts, that completely changed me. I remember my very first patient on my first day in the psych ward, and she was getting admitted, and she had her daughter with her and her husband, and the husband and the nurses and the doctors were all busy doing the admission paperwork, and there was no one really watching this child. So I raised my hand and said, hey, like, I'll go hang out with her, we'll color some pictures, kind of thing. And I remember sitting with this little girl, and she's telling me all these horrible things that she's witnessed because her mom was really struggling with her mental health. And I remember just thinking, like, she was so innocent and free spirited, she didn't even realize the kind of things that she had been witnessing. And that kind of stuck with me. I did my final preceptorship in psychiatry as well because I knew I loved it, and I got a job offer from a pediatric psychiatric unit. It's funny now because I honestly can't imagine myself doing anything else. And I like to think that it was that very first case on my very first day in psychiatry with that one sweet 7-year-old girl that was kind of my sign that psychiatry was where I was going to be. So yeah, I didn't choose nursing, it chose me. And psych, it's the part that made me stay.